I'm going to show you the dental panel in the imaet system. So we're going to come to the navigation page, and under our bioscan tab, you will find dental towards the bottom. So we're going to click on that, and it brings us to this page. Here we have several scans and several things we can do. In the top left-hand corner, we have a 5-minute TMJ feedback. So this has different acupuncture points that have to do with TMJ pain. So this is a little 5-minute button if we click on this. Then below it, we have two separate scans. We have a dental material scan, which has all of the different dental materials, and a description down at the bottom of the left-hand side. If we click bioscan, this will scan all of these items. And underneath of the dental materials, we have a dental disorder button where we can click bioscan, and this will scan through all of these dental disorder items. If we look down at the bottom of the left-hand side, we can see that there are also descriptions of that as well. If we come up to the top of the right-hand side, we do have a little quick way to get to the 4 most common dental disorders, which are gum disease, oral abscess, nerve repair, and thrush. Now that our scan is done, we can see the top item comes up in red, the next one will always come up in yellow, and the next item will always come up in blue. And if we scan down to the bottom item will always be highlighted in green. We can either click on one of these items and come over here to feedback on the right-hand side and put in our time and run this frequency, or if we don't click on anything, it will run these top 3 frequencies. We click interface if the client is hooked up to the machine with the harness, or virtual if we are sending these frequencies remote. If you have a virtuoso, you will only have one button that will say feedback, since that only does virtual treatments. Since I have not clicked on anything, it is going to run through these 3 items. It will run through the first one for the first third of the time and then give us a harmonized percent. It will run through the second item for the next third and the third item for the next third, giving us the harmonization after every third of this time. If at any point we want to stop this feedback, we can press stop. In the middle of this panel, we also have an energetic response for each tooth, and we can press bioscan, and that will scan through every tooth in the mouth. The ID number on these teeth is the tooth number in the mouth, and we can see here in the middle that we have a chart of all of the numbers of teeth in the mouth. I also like to point out, if you can find the chart online for holistic dentistry, it will tell you which organ, which parts of the body, and which meridians each of these teeth connect to. Now, the top items are going to come up in those same colors. So we can see tooth 22 came up as the top, and we can find tooth 22, and we can see it's on the lower left-hand side of the mouth. Tooth number 14 is going to be on the upper left-hand side of the mouth. And tooth number 30 is going to be on the lower right side of the mouth and one of the molars. We can scan down to the bottom to see that the first bicuspid on the lower right, or tooth number 28, has the least amount of energy. What I tend to find are the ones up top are either causing pain, or they're correlated to a meridian or a part of the body that might be causing pain. And if we go down to the bottom, the tooth at the bottom may have a dying nerve, or it may just not be receiving enough energy. Again, we can click on one of these items and do feedback over here. We can also add focus to any of these frequencies on this entire panel. So we could add inflammation, infection, degeneration, or pain. If we click on the button to send energy there, at the end of the time that it takes for this blue line to go across, it will then go across for each of these added focus items. At the bottom right-hand corner of this panel, we have a panel info button. If you click it, it will tell you all about this panel. And that's it for the dental panel.